All right, so Antjuan Seawright is joining us now. Antjuan usually joins us to talk about politics, but not today. Antjuan, you wrote an opinion piece for The Hill about this very topic, about the risk that African Americans face, not necessarily when it comes to contracting the virus, but certainly dying of it. And for you, the doctor talked about all the medical stuff, but for you, this is pretty personal because you're dealing with with it within your own family right now.
Yeah, my mother was tested positive for coronavirus, and so it has definitely shed a different lens for me personally. And there's an old Southern adage that we say in the South where I grew up that when certain communities get a cough, communities that look like mine get the flu. And I think from all the data and the research seen, these things have come to be true. When the world is starting to see what we as African Americans have known all this time, we are less likely to be tested in these situations, less likely to be treated, but more likely to be on the front line doing the work. So there's higher exposure, asthma, high blood pressure, hypertension, all those things cause us more likely to die. And it's a problem not just for this, but it's a problem even before this, and when this is over, it will continue to be a problem.
Antjuan, certainly sending you and your mom some good cheer, good energy, and praying very, very hard for her. I'm sorry you're going through this. I'm sorry she is as well. But aside from the pre-existing health conditions that Dr. Fauci mentioned, break down for our audience what other socioeconomic disparities you've seen in the way this pandemic has engulfed this country, specifically African Americans, Black people.
Well, this is, again, exposed the fracturedness in our healthcare system. Glad if you look at states like where I live in South Carolina, where the state leaders refuse to expand Medicaid, that means access and delivery to care is a problem. Also, affordability is a problem. And so when you combine accessibility and affordability, those things are an issue. Those things impact communities that look like mine even more. When the unemployment rate is one thing in certain communities, it's almost double and triple in African American communities. You can say that with education. You can say that with access to the internet. And now we're seeing that firsthand when it comes to delivery in our healthcare system. And so the exposures and the flawedness in the system are being exposed to the world for those of us who've seen this firsthand for a very long time.
Yeah, I know. There's been obviously this public push to stay at home and stay healthy and work from home. And I think what's not included in that conversation that may be happening here is when you're part of the sort of second tier of frontline workers. You're not in the medical field, but you're the one that works at the grocery store that's staying open. Or I have a number of people in my family who work for a public transportation. There's no stay at home for them. They have to be facing the public on a regular basis. Or when you say, go out for a walk in the park if you need to get out. Well, if you live in a community where it's not safe to walk outside or, the park is not a safe place to be, then these are not options. And I know that people will see pictures of, groups kind of gathering and they'll scratch their head and think, what are you doing? Well, part of that is that, that some of the directives do not also take into account that we don't all live in sort of the same safe, clean, nice suburb.
100%. And I laughed when I heard people online or when I saw people online talking about wearing their masks when they go out in public. There are stores in South Carolina where I live where there's a sign on the door that says you cannot come into the store location with a hoodie or your face being covered. And guess what? We all know what those type things are directed at. And I'll take for a prime example, there are people I know who live right down the street that they could not Zoom into a meeting for work if they needed to. The only Zooming they can do is Zooming their way on the clock to make sure they can feed their families and maintain their somewhat measured quality of life. And so the rules do not apply for everyone the same way. And that's what I think this virus has exposed again to the rest of the world. What works for some may not work for others. And for communities that look like mine, who've been suffering for a very long time, and always starting the race 2 laps behind, we're automatically are going to be 2 laps behind when it comes to trying to get across the finish line.
Yeah, Antjuan, you bring up a great point, which is that some of the things, the luxuries in essence that may be available to some of us are oftentimes not available to those who are on a socioeconomic scale that many Americans sometimes struggle to imagine, which is why it's easy to have blanket statements about, Netflix and chill, or, Zoom in and have a cocktail party with your friends on Zoom. And that's just not the reality for a lot of people. And so the fact that you may, in certain instances, see people congregating in an outdoor area on somebody's stoop because they need to get out of the house is something that, that becomes the reality of the situation for a lot of Black and brown people in this country. And so the question, of course, and I've often said this in the last couple of days, that we really won't even know the impact that this virus, this pandemic, has had on people, Black and brown people, because we're still in the midst of this and we're still trying to contain the pandemic. The aftermath of it will be when we realize how devastating this is. And Antjuan, you probably know this, the numbers are probably lower than what has been reported because testing in this country is so happenstance. Testing in this country is so spotty at the moment.
Well, Vlad, when you have communities where the nearest hospital is 1 hour away, like in South Carolina, where we've had 4 closed, we know testing is going to be an issue. If the hospital is 1 hour away, 45-minute drive, can you imagine what the process would be like to test? In some states, you have to go online and fill out a form to talk about your symptoms, telehealth, in order to be determined whether you will get tested or not. So therefore, someone will determine whether you're tested or not by a telehealth scenario. That's not safe and that's not good because you can't measure that. And if you're lucky enough to have transportation to get to a tested location, you then wait 5, 7, sometimes 10 days in order to get those results back. Well, a lot can happen in that time frame. Not to mention when you talk about just, I call it the argument of the have and the have not, this has impacted not just the healthcare system, but the education system. We have buses that go to communities, Lab, in order to have Wi-Fi access so kids can access the assignments they have to complete in order to just get through the school day. And so all of these things continue to be an issue for some communities, but they are life or death for communities that look like mine.
Antjuan, I'm so glad that you brought up that last bit right there, because I wanted to talk to you about the beyond the health implications, all the other hurdles that African Americans are facing because of this coronavirus. We've seen it here in Philadelphia, where kids were sent home very, very quickly, where there's a directive that you cannot have education that is unfair. And with the awareness that many, many children don't have laptops or at home, initially the public school system could not do online learning because it just wouldn't be fair to kids who don't have access to that kind of equipment. Now they had to scramble and find a way to get all the kids laptops or iPads, and so they're doing what they can do. But it's not just the education; it's also the jobs, the types of jobs that may not return after this pandemic is over. If you talk to anyone who's sort of a historian when it comes to pandemics, they will tell you that the people that suffer the most are the people who are socioeconomically lower before the pandemic occurred. They're the ones that find it very, very difficult to bounce back even after we're all healthy.
I live by this scenario. The people who are impacted the most are usually the ones who participate the least. And when I say participate the least, meaning have a say-so and what their life will look like. And I think when this is all over, we're going to see that in a very real, measurable way when it comes to certain communities. And I use the broadband example so many times because it goes beyond just education. It's when you're trying to do telehealth and you do not have broadband access, you can't get online with a doctor. And the truth of the matter is there are people in this country who are worried about 4G and 5G. I'm more concerned about the people who have no G and who do not have access at all. And when you look at rural parts of this country, whether they are predominantly rural African American areas or predominantly white rural areas, we all have the same issue, lack of access. And so the argument that when this is all over for lawmakers and people who make decisions is, how do we make the American experiment accessible and affordable for all, whether that's healthcare, whether that's housing, whether that's infrastructure, including broadband access, all these things. We have to learn to make them accessible and affordable for everyone.
And Antjuan, before we wrap this up, we can tap your political expertise, your political background, because we saw an election happen in the state of Wisconsin yesterday, which when I looked at the number of people who turned up to vote yesterday in Wisconsin's primary, and I saw a lot of black and brown folks. Now, as you know, that state has had a history of gerrymandering districts, of disenfranchising voters. The largest newspaper in the state essentially called it unimaginable what took place yesterday, asking voters to choose between their life and their civic duty, their civic responsibility to cast their ballots. And yet you saw people braving the risk, braving the danger to go and cast their ballots. And this is something that we've seen in Wisconsin over the past year or so. And what was surprising was that the state Supreme Court overturned the appeal by the governor to try and delay this primary. Were you surprised?
I wasn't surprised at all, because leopards do not change their spots and zebras do not change their stripes. And so we've seen what the Republican leadership, not just in Wisconsin, have tried to do when it comes to voter issues around this country. But I'll say this, I think black people showed up in Wisconsin because this is a life or death type election for people who look like me, Vlad. And the fact of the matter is, while some things are an urgency for some, they are a red light emergency for others. This election will be a red light emergency for people who look like me because of some of the very things we just spent the very past few minutes speaking about: education, healthcare, economics. All those things matter. They matter times 2, times 3, even times 4 or more for communities that look like mine. So make no mistake, do not look for black people to sit home in this election because of the red light emergency that comes along with this election.
Antjuan, it's great speaking to you. You know, I just wanted to let the audience know something, too, because we've been talking a lot about the intersection of race and socioeconomic status and its impact. Many of you may have seen the interview that I did with Dr. Elmore earlier when we all had to start working from home. He works with elderly people. That's specifically what he does, and he gave some really good advice about helping your older loved ones. He learned yesterday that his father passed away because of the coronavirus. He was older. He did have another health condition. But, you know, he had all the information he needed. His son is a doctor, and now Dr. Elmore must continue working while also grieving with his family and without his family, because he physically can't be there with them because he's so concerned about the spread of this virus. So, you know, socioeconomic status is one thing, but this virus also knows no boundaries at all. Antjuan, I want to thank you so much.
And Marie, if I could just say to you all, thank you to the people on the front line every day. Our healthcare workers, our essential workers, you all are literally keeping this country together. And the two most important words in the English language, as we say in South Carolina, are thank you. And from the bottom of my heart, I would just say thank you for everything you all are doing.
Yeah. Thank you, Antjuan.